Well, as public faith in public health officials reaches an all-time low, we can thank Joe Biden for having appointed a new chief of the Center for Disease Control, someone who will provide common reassurance in these ages as we start to come out of this pandemic. Joe Biden's director of the CDC, Center for Disease Control, is Dr. Rochelle Wallensky. And she's recently said on camera in an emotional way, as you'll see in just a moment, that she has a vague sense of impending doom.
When I first started at CDC about 2 months ago, I made a promise to you. I would tell you the truth, even if it was not the news we wanted to hear. Now is one of those times when I have to share the truth and I have to hope and trust you will listen. I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one because their loved one couldn't be there. I know what it's like when you're the physician, when you're the healthcare provider, and you're worried that you don't have the resources to take care of the patients in front of you. I know that feeling of nausea when you read the crisis standards of care and you wonder whether there are going to be enough ventilators to go around and who's going to make that choice. And I know what it's like to pull up to your hospital every day and see the extra morgue sitting outside. I didn't know at the time when it would stop. We didn't have the science to tell us. We were just scared. We have come such a long way. 3 historic scientific breakthrough vaccines, and we are rolling them out so very fast. So I'm speaking today not necessarily as your CDC director, or not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet.
Hi, everybody. I'm Bill Whittle here with Steve Green and Scott Ott, and we're not going to be talking about the actual trajectory of the virus because that would be science and no one's interested in that. What I do want to talk about is the emotionalization of not only of science, but the emotionalization of public officials. Steve, when I heard that that the CDC director is basically saying we got to keep wearing our masks because she is afraid, she's scared of impending doom, I find that to be reckless language designed to keep the fear porn levels high. But even if she's correct about what would happen, I don't think the director of the Center of Disease Control needs to be talking about being scared, and I don't think they need to use terms like impending doom unless there's something to be scared about, and that would result in impending doom. And nothing out there is even close to that at this point.
Yeah. You remember on December 8th, 1941, when President Roosevelt addressed Congress and said, we have nothing to fear but the Japanese marching right through Washington, and they probably will. We should just give up right now.
I've got to go. I've got to go. Plane is waiting.
Get me out of here. Churchill said, we shall fight them on the beach. Oh, I don't know. Sounds dangerous.
I'm scared out of my wine. This Hitler terrifies me. I don't know how we can go on.
Donald Trump showed us a whatever you think of. I don't care what you think about Donald Trump as a person or as a president, any of that. Put politics aside. I want to talk about a time he showed genuine leadership, which Miss Frady Cat over at the CDC wouldn't recognize if it went boo and made her pee herself. Trump got the coronavirus. He spent 3 days in the hospital. He's a 73-year-old guy. He's overweight. He's in at least 2 risk groups for dying of this damn thing. And the day he got out of the hospital from a severe respiratory infection, in front of the cameras, he got out and walked up those steps, that big flight of stairs. And yeah, He was wheezing a little bit when he got to the top of those stairs. He was winded, but he led us. He gave us the example. He showed us that a guy can beat this thing and go out and do what he did. That was a hell of an example, and it's exactly the opposite of what we're getting now under Biden, who just went on yesterday, gave another one of his mush mouth little videos in which he said we all have to wear our masks. These states that are reopening, they shouldn't reopen. And yeah, it's panic mongering, Bill. The Democratic Party thrives on the panic mongering. They get enough people upset. They get enough people worried. They get enough people scared. You can't even reopen the schools after the teachers have been vaccinated. Yeah. It's so very bad. And it's all about establishing political control through maintaining fear. And here's why they're upping the ante, because things are getting better. Florida has been reopened with, some common sense protocol. Texas has just reopened with common sense protocols. South Dakota never shut down. We're watching these states loosen things up. We're watching these states boom, and nothing bad is happening. We're not watching the corpses pile up like firewood outside the overstuffed hospitals. None of the things that were supposed to have happened a year ago happened. None of the things they told us would happen if we reopen are happening in the places that are reopening. So who are you going to believe? The crybaby head of the CDC or your own lying eyes?
This is the point. I'm not an unreasonable person. I'm really not. If it turned out that Florida and Texas had people dropping like flies, yes, and the hospitals were overloaded and there were no ventilators available, you wouldn't hear me talking about this. You wouldn't hear me mocking her for this. But this is not what's happening. And we find out just now that she just appeared today, apparently, on the Rachel Maddow show. Rachel Maddow, of course, is definitely in favor of people remaining locked down because she gets paid millions of dollars, whether there's lockdown or not. She's getting paid. That's something I've noticed about people's attitudes towards this thing. But on that show, the center of the CDC said she couldn't bear another big outbreak. What does that mean, Scott? I know what she's saying, and I know why she's saying it, but she is not just a government official. She is the government official in charge of preventing infectious diseases throughout this country. And this one has been pretty mild compared to what it could have been. If she is saying now she can't bear an uptick in COVID-19 cases, how are we supposed to have confidence in this person if we find ourselves with some sort of aerosolized Ebola or something genuinely horrific? This kind of language it's self-defeating, and that's the best space I can put on it.
In a lot of positions in government, I think we need to see more precision in language. In this one in particular, to speak exactly what you mean rather than if she literally said a vague sense of impending doom, those are words that she should stand up tomorrow and say, you know what? I don't have a vague sense of impending doom. Here's the actual data. This is what I'm concerned about. This is why I think we need to wear masks. But the reason why she did that is very calculating. They have a message they want to get out. Their message is that the states like Florida and Texas and elsewhere that have lightened up on the mask mandates and other kinds of restrictions need to dial that back down again because it's possible that a second wave, a new mutation of the virus, or, we're not out of the woods yet, all that kind of stuff. So if they believe that, they're studying this as a PR problem. And they're saying, okay, people have seen hundreds of these COVID briefings. How do you break through this sort of dull moan of hundreds of COVID briefings? You've got to have something that gets a headline. And so that her so-called off-script moment, I don't think was off-script at all. I think she fully intended, whether she told anybody else she was going to do it or not, but she fully intended to go off-script because she was trying to connect in a way, not just that would reach the hearts and minds of America's wives and moms or compassionate dads, but she was trying to connect with the people who write headlines in the mainstream media. She was trying to give them something they can feature on the front page instead of page B13, where it would have gotten buried along with the many other updates as the trend, slowly and gently goes down. So they needed something sensational. They needed to say, one of America's top scientists is at the brink of tears fears and fears impending doom. And she stood feeling helpless at the hospital when she was watching people die alone without their relatives. So they're trying to do something with emotional punch to reconnect with the editors in newsrooms. And frankly, on that basis, big success.
Yeah, that's right. And this is how we create a nation of children and keep them that way. We basically don't trust them enough to tell them the truth. We know what they should be doing, and so our job is to scare them into doing what they should be doing. And if we have to exaggerate the threat, then that's what we'll do. We think carbon emissions may be high and global temperatures are creeping up, and that could be bad on the long term. So we'll tell people the planet's going to die if you don't do what we say. It's going to die in 5 years. And then they wonder why nobody trusts them when these kind of predictions don't happen. At least they don't happen according to the alarmist level. What is going to happen to this woman if, just on the off chance that these cases continue to drop and more people continue to get vaccinated, what's going to happen in 2 months if doom does not strike the United States? Is she going to be held responsible or accountable for these words of impending doom? How quaint, my dear, dear summer child. No, that's not going to happen. And so they continue to ramp up the emotions. Scott talked about this in his segment this week about the trial in the George Floyd case. Not about reason. It's not about rationality. It's about emotion. And I have to tell you, it's not just a question of this person playing to the camera. I believe she's probably feeling this. I don't think she's acting. But I come back to this again. The CDC used to have an extraordinarily good reputation, really superb. Badly tarnished in the years leading up to this year, and then this last year, very badly tarnished. But nevertheless, it is the agency that is responsible for what is the most likely case of severe damage to the human species. That's really it. If you want to talk about the most likely case of something that really cuts through society and changes it on a fundamental level, I think your best agent is a genuine pandemic of a very, very serious disease. And I personally don't want to live in a country where the person who's in charge of this enormous responsibility is already about to burst into tears. I'm sorry, I just don't. I would rather have a steely-eyed missile man of any particular sex or gender who's going to look at this and do what is necessary and right to be done and not what the emotional thing is to be done. I don't want, Steve got it exactly right. I don't want leaders or people I don't want the chairman of the Joint Chiefs of Staff to be saying things like, oh, these Chinese, we just got to keep them off us because if we ever get in a fight with them, they're just going to kick our butts. This is not what you want in terms of leadership. And it is not only disturbing, but alarming that this person would be making these kind of emotional statements. I can't bear another outbreak. Well, what happens if there is another outbreak, dear? What are we supposed to do if you can't bear it? You've just told us that if something bad happens, you can't handle it. I want somebody who can handle it. Is that too much to ask? Apparently it is. We'll come back to you next week, of course, unless the impending doom strikes, and then you'll just get just a carrier wave, the blank signal. But assuming that doesn't happen, we'll see you next week right here on Right Angle.